Did you know that even among kids who physically can swallow a pill, about 69% report having some fear of doing it?
If you're a parent of a kid between 5 and 15, you've probably faced the dreaded medicine time meltdown. Well, today we are tackling one of the absolute most common yet most highly fixable childhood fears that literally nobody talks about, the fear of swallowing pills. We're going to break down the science, the psychology, and a proven method you can use right at home to empower your child.
Okay, let's dive into this. The pill swallowing struggle is incredibly common. It actually affects up to 54% of kids who have absolutely no physical swallowing issues. It's this hidden, everyday battle. Now, you might be wondering, hey, why not just stick to liquid medications? Well, as you probably know, liquids aren't always the magic fix. First off, they can taste unbelievably bitter or just plain awful, which leads to a totally different kind of fight. Plus, a lot of liquids require refrigeration and expire really fast, which is a huge headache if you're traveling or sending meds to school. But the biggest thing, liquid medications actually come with a much higher risk of accidental dosing errors because the concentrations vary and those little syringes are super easy to misread. Switching to tablets is safer, it's way more convenient, and it opens up access to better treatments.
So when your kid flat out refuses to take a pill, what is really going on?
As a parent, it is so easy to see this refusal as just bad behavior or a battle of wills. You ask them to take it, they clamp their mouth shut, and suddenly you're in a standoff. But we've got to separate the myth from the facts here. The myth is that they're just being stubborn. But the empowering truth, this is simply an anticipatory fear combined with a missing skill. In fact, the European Medicines Agency points out that swallowing solid medication is a learned skill. It's not some innate talent. Just like learning to tie their shoes or ride a bike, your kid just needs to be taught the mechanics in a safe, stress-free way.
And here's where the medical community comes in to save the day, using a gentle, evidence-based approach called behavioral pill swallowing training, which uses shaping and modeling. And the evidence for this method is genuinely strong. Check this out. In a large hospital series evaluating this exact training, a massive 88% of children successfully learned how to swallow a placebo pill. Just think about that for a second. Nearly 9 out of 10 kids who previously couldn't or wouldn't take a pill did it after a simple training intervention. But here's the really crucial part. They didn't just swallow a microscopic mint. Among those kids in the hospital series, 73% successfully reached a clinically useful pill size. So they worked their way up to a size that would actually allow them to take standard, necessary medical capsules.
And this brilliantly illustrates that this isn't just a rigid, one-size-fits-all system. It's incredibly adaptable.
The clinical data confirms this works for kids as young as 5 years old. Plus, adapted protocols of this exact same training have worked absolute wonders for autistic children, kids with ADHD, and even medically complex patients going through things like cancer treatments or managing cystic fibrosis. The core mechanics of the training are exactly the same. You just adjust the pacing and the environment to empower the child.
The real-world success here is striking. Look at this. In one pediatric renal clinic, over just a 3-month period, they identified 25 kids who were on liquid medications but were eligible to switch. By using these training techniques, 21 out of those 25 patients were successfully converted to tablets. It just goes to show how quickly this barrier can be broken down when you have the right process in place.
So what is this process? Let's break down the pill ladder technique that you can use right at your own kitchen table.
Here is the bite-sized physical process. Step 1. Relax the body. You want to find a comfortable spot with absolutely zero distractions. Step 2. Model the motion. Let your child pick a drink, sit facing them, and physically show them how you swallow a small sweet or practice pill. And Step 3. Climb the pill ladder. You're going to start incredibly small and gradually increase the size.
Now, what's really interesting about this slide is you do not start with a giant antibiotic. You start with something totally unintimidating, like tiny candy sprinkles, the kind you put on ice cream. Once they master that, you move up to maybe a Tic Tac, then a mini M&M, and eventually up to a Skittle or standard dummy gelatin capsules, which range from size 3 up to size 00. You actually hand the control over to your kid by letting them pick the sweet, and you only move up to the next size when they are 100% confident with the current one.
Now, the physical technique is just as important as the size. Have them place a practice sweet right in the middle of their tongue. And here is a huge tip. Tell them not to throw their head back. That's a common mistake. Have them keep their head in a neutral, normal position. Then, they seal their lips around the top of a sports bottle or a straw and take 3 big gulps of water or juice without putting the bottle down. That sucking action naturally carries the pill right down the throat before they even have a chance to overthink it.
So we've got the technique. Now let's talk about how to gamify that bravery and really conquer this fear.
The science really supports these brief, engaging sessions. One study found that a single structured training session cut pill-swallowing fear by about 39%. That is a massive drop in anxiety from just one focused interaction. Best of all, that fear reduction held up even when the training was delivered remotely via video or taught peer-to-peer. You literally don't need a doctor in a white coat to fix this. You can absolutely lead this right at home.
Before we get to the ultimate home tool, I do need to deliver a very quick safety note. While this is a highly learnable skill, safety obviously comes first. Please consult a pediatrician or a pharmacist if your child has a diagnosed swallowing disorder, if there is any genuine choking concern, or if a critically needed medication cannot be taken while you're still practicing. This training is for anticipatory fear and skill building, not for overriding complex medical swallowing disorders known as dysphagia. But for the vast majority of families dealing with standard pill aversion, a step-laddered, gamified approach is just the perfect fit. This is exactly why tools like the Fear Me Not app were created. It maps perfectly to this step-by-step method, turning the clinical pill ladder into a gamified bravery win. It tracks their progress, rewards their successes, and really takes the pressure off you as the parent, turning what used to be a stressful battle into a collaborative, upbeat game. So the next time medicine time rolls around, remember, this isn't a behavior issue, it's a fear issue. And fears can be beaten. Give them the right technique, start small, and use the pill ladder to build their confidence. Our message to parents and kids dealing with this is simple, upbeat, and practical. Don't calm down, conquer. You've got the tools and they absolutely have the capability. So what step of the ladder will your child conquer today?